We really don't understand why being born prematurely has affected their ability to develop their lungs properly to protect against the infection. One of the things that we're trying to do is not only understand that process, but eventually so we can develop therapies to help the children. It's sort of an analogy that we have with eyeglasses, where what we have is we've figured out how to deal with some of the deficits of being born prematurely, much like we figured out how people who normally can't see very well, we give them eyeglasses. And yet by giving them eyeglasses, we haven't really fixed the problem, which is that the eyes are not functioning properly. We've put a Band-Aid on it, if you will. One of the biggest issues of being born prematurely is that the lung is not ready to breathe air that is born into. And so because of that, the air that the child is exposed to affects the normal development of the lung. And because the lung is not mature, often then we have to give the child even extra oxygen in order to survive. And so the combination of the room air that the lung is exposed to prematurely, the excessive oxygen that the physician might have to give to the child to help keep the blood have enough oxygen, now causes the lung to develop abnormally. And part of that abnormality is that it does not deal with respiratory viruses very efficiently. And so we have vaccines that we can give. We can do these kind of treatments that are sort of like providing an eyeglass. It helps, but it hasn't really solved the disease. It just has attenuated the disease.